Good afternoon, ma'am. I'm Ailey CJ Moribigo Muad, your student nurse. I'm going to demonstrate on how are we going to provide eyes, nose, ears, and oral care to our patient. So the equipments that I'm going to use are towel, a bath towel, face mask, sterile gloves, a cup of water, toothbrush and toothpaste, mouthwash solution, goose bandage, petroleum jelly or lip balm, tongue depressor or oral swab, and a emesis basin. So the next thing that we're going to do is perform a hand hygiene technique, apply sterile gloves and face mask, and explain and introduce to your patient what you're going to do, whether your patient is conscious or unconscious, because there's a concept that we need to explain and introduce to your patient what you're going to do, because sometimes they might hear us. Next, provide the client privacy. Perform a hand hygiene technique. Good afternoon, ma'am. My name is Ailey CJ Maribico Juan. I'm going to be your aide for today. I'm here to do a oral care on you. Is it okay, ma'am? Okay, thank you, ma'am. Next, put a bath towel to your patient and place it across the chest. And then, give her a small sip of water to moisten her mouth. Next is apply toothpaste to the toothbrush. And begin brushing her teeth. Front-back motion to clean the outside and inside surfaces of the teeth. Make sure you use front-back motion to clean her tongue. Move the front and use an upward down motion to clean the front of the teeth. After the teeth are clean, I will offer the emesis basin so she can spit out the extra toothpaste and offer her a water that she can swish and spit. Next is offer her a mouthwash and allow her to rinse her mouth. Next, offer her an emesis basin and a water. Wipe using a clean towel in the corner of her lips. And lastly, apply her a petroleum jelly or a lip balm. Next is remove the bath towel on the patient chest and keep your patient in comfortable position. Next is the unconscious oral care. Explain the procedure and introduce yourself to your patient whether your patient is unconscious. Position the patient in side lying position with the pillow behind her back to prevent aspiration. Next is put a bath towel under the face of the patient in case of drainage. Take the emesis basin and place it near her chin and under her mouth to help to collect anything that drains out her mouth. I will start the oral care by using a solution of mouthwash. Take the oral swab and get it wet in mouthwash solution. I will use the oral swab to clean the outside of her teeth and inside of her cheeks. Always make sure to keep the oral swab in her mouth. Next, use another oral swab with water and wipe the entire mouth to help rinse the excess of mouthwash off. Use a padded tongue blade to place it between her teeth and hold her mouth open if her mouth is not open on its own. I will remove the emesis basin and use a towel to wipe her face. And apply lip balm to your patient. Remove the bath towel to your patient. Position the patient in the center of the bed. Make sure your patient is comfortable in his or her position. And then, remove your used gloves and perform again a hand washing. And that's all. Thanks for watching!